I begin the fifth session. This is halfway through our 10 series session protocol for working with the structure to derotate segments to create organized space throughout the structure. So we'll briefly discuss any changes that might have transpired. We do that with each and every session, but I'd like to give it more attention at the halfway point, make some notes of that, and then we begin. The fifth session will be similar to the first session, except more core structures will be integrated into the work, into the differentiation process. But again, we'll work to normalize the pelvis. And the reason we are continuously working to normalize these structures is that it takes the course of 10 sessions or somewhere between 11 and 12 hours worth of work to really get these structures to adhere to the change. It doesn't happen in one session, or we would address everything with one session. And it doesn't always necessarily happen in 10, but that's where we start. And halfway through, we want to make sure that we are continuing that process so that we can keep decreasing pain and increasing movement. But again, working much like we did in the first session, working with the femurs to derotate these femurs, normalizing the pelvis to balance it out. Again, working all the way up the spine to do more detailed work, derotating these segments from the front to back, left and right, top to bottom. I like to refer to this as working in the three primary planes of movement, which is flexion, extension, side bend, and rotation, working to lengthen, derotate, or fluff these areas. Working up to the ribs, this is a great opportunity to do more detailed rib work on both sides. Possibly working down to the fingertips again, but usually by the fifth session we've normalized pain, discomfort, and mobility in these areas. So we might not have to work there, but we will if we need to. Giving more attention though to the shoulder girdle, working with structures that keep those scapulas in place. Rhomboids, obviously, are going to get some work. The serratus tissues and structures are going to get some work. So I like to work all the way up to the clavicles, continuing to normalize these structures up the neck. Again, to end the work with detailed neck work, detailed back work, and then some type of movement integration to help induce or augment contralateral movement between the girdles of the body.